Ladies and gentlemen, thank you for joining Business Roundtable today to discuss health care reform. Leading today's briefing will be Mr. John Castellani, President of Business Roundtable. At this time, all telephone participants are in a listen-only mode. Later, we will conduct a question-and-answer session, where you will all be given the opportunity to ask a question about Business Roundtable's positions on health care reform. If you should require assistance during the call, please press *0. I would now like to turn the call over to Mr. Castellani. Thank you.
Thank you, Tammy. Good morning, and thank you all for joining us today. As Tammy said, I'm John Castellani, and I'm President of Business Roundtable, and I'm joined today by Maria Gazal, who is our Policy Director for the Roundtable, who covers health care issues. Business Roundtable members are chief executive officers of the nation's leading companies, and collectively, they provide health care to 35 million American workers, retirees, and their families. And as you all know well, health care reform is both a key issue for President Obama and a top priority for us. We've worked since day one to find bipartisan solutions to the health care dilemma, and our efforts over the past few weeks have been no exception. Companies have a stake in getting it right. We believe in reform, and we believe it can happen now, and that this is our opportunity to get it right. We believe that there are three components to a successful reform bill. First, it needs to provide a system that has the flexibility to be innovative and allow users to get more value out of our health care system by delivering higher quality care at less cost. Second, from our perspective particularly, the bill must also preserve ERISA. It is the foundation of our health marketplace, and we cannot let it be eroded. Lastly, the bill must also prevent the cost shift. Now, the government does not have a good track record in managing costs or promoting innovation and efficiency in the marketplace. The employer community is united in the belief that we must achieve real and permanent cost cuts in the system to avoid the continuation of cost shifts to other payers. When we think about true reform, we need to advance a health care system that not only works for the companies and the health insurance companies, but for everyone, those with chronic diseases, those who have pre-existing conditions, and the middle class and less fortunate. To achieve this, we have been working closely with all players on a bipartisan basis to change the system. We've been in near constant communications with the White House and the Congress, and we believe we're working as an honest broker to bring about reform. In fact, less than 2 weeks ago, Antonio Perez, who is the Chairman and Chief Executive Officer of Eastman Kodak and chairs the Business Roundtable's Consumer Health and Retirement Initiative, met both with Senate Finance Committee Chairman Baucus and Ranking Member Grassley to advance our consistent goal, ensuring that Americans keep what they have, help small employers and individuals find affordable coverage, and start slowing the rate of growth in health care. In fact, Antonio was kind enough to spend that whole day meeting not only with Baucus and Grassley, but with Majority Leader Reid, other members of the Congress, and the White House. And it's indicative of how important Business Roundtable CEOs view a successful outcome of this debate. Now, while we don't agree with everything that's in the legislation that's being currently discussed, we do firmly believe that all parties must remain at the table to get reform right the first time around. To achieve affordable, high-quality health insurance and high-quality health care, everybody needs to be a part of the solution. We're working hard to achieve that, and we're especially today supporting and working with the efforts of Senators Baucus and Grassley, who are meeting with the President along with the other members of the so-called Gang of Six. We work closely with their efforts. We've been encouraging them and providing them information that they feel that they need. But the key for us is if they are successful, will the President support their version of reform? And with that, I'll now take some questions. So, Tammy, why don't you open it up for questions?
Thank you. If you are on the phone and you want to ask a question about today's briefing, please press *1, unmute your phone. If you want to withdraw your question, press *2. We will now take questions. We have a question from Mark. Mark, your line is open.
Yes, Mr. Castellani, does this statement mean that that the Business Roundtable and presumably others in the business community would not get behind reform that mostly follows the path set out by the Senate Help Bill and the House Tri-Committee Bill, and how are you going to make that determination when all of these different bills have finally been melded into one product?
Good. Thank you, Mark. The House bill, the Tri-Committee bill, presents us with some serious problems, and let me cover just a couple of them. First and foremost, our objective as payers for health insurance and health care coverage for our employees and their families is to be able to continue to do so. It is the single biggest healthcare is the single biggest cost pressures our members face. A couple of things about the House bill make that cost worse, not better. The public plan, the so-called public plan that's included in the House bill, for example, not only continues to under-reimburse providers, it exacerbates the cost shift that we currently bear in the Medicare and Medicaid systems even further. So the so-called public plan option hurts us even further by making us bear more of the costs of the under-reimbursement by the government. So first, that it hurts us that way. Secondly, the one thing I think everybody agrees on is that the best way to get control over healthcare costs, the so-called best curve, is to have the kind of innovation and creativity that we know the private sector does well and we know government can't do well, so that the House then injects another government player that not only shifts costs but doesn't drive to reducing the costs through innovation and the kind of creativity we need. The third problem that we have with the House bill is that it contains a number of costly and unacceptable changes to ERISA that will undermine our ability of our companies to sponsor health care coverage for their employees and their families. Again, Business Roundtable companies, as the largest companies, are 50-state employers, and as a result of that, we need the kind of flexibility that ERISA gives us to be able to have a program that works for all of our employees and their families and not have to deal with state-by-state mandates that cause us to have 50 different plans rather than the one plan that we can afford. So it presents us with a problem. We'll have to evaluate where the process turns out, but our sense is, based on the discussions and what we know about the discussions right now, that the Finance Committee is closer to getting it right than any of the other bills that exist right now.